The next person is Rae Nadler-Olenick. Thank you. I'm sorry I butchered that, Ms. Olenek.
Okay. Good afternoon.
This is for council.
Yeah. Good afternoon, committee members.
Extra copy for.
So I start. In 2011, following discussion with Austin Travis County Public Health and Human Services, the Austin City Council, like many other local governments, voted to adopt an advisory for parents concerning fluoridated water and infant formula. The advisory is to be based on the CDC's recognition that fluoridated water consumed early can cause dental fluorosis in children's developing teeth. Up there is an example of what the dental community calls mild. And yes, it can be fainter, but it can also be a lot worse and still be classified as mild. So we're not talking about something trivial. Today, half of U.S. teenagers already have some form of this permanent condition. We've handed out a copy of the advisory as it appears on the annual water quality report, on the City of Austin website, and on a bilingual flyer available in area WIC centers. The last sentence is highlighted in yellow. I'm here to respectfully request that that sentence be deleted for 3 reasons. First, it's inappropriate because it speculates on what some unknown doctor might or might do in the future. Guesswork has no place in an advisory. Second, it's misleading. It implies that parents who seek to lessen the threat of fluorosis in their newborns by avoiding fluoridated tap water are somehow doing a harm that might need to be corrected on baby's 6.5-month birthday. Young first-time mothers are especially likely to read it in that way. Third, and most important, it is not part of the CDC's recommendation. It's the tacked-on personal opinion of one pediatrician from whose writings it was cut and pasted word for word. And I will let Linda continue, please.
Thank you, Ms. Greene. If you'll come forward, please. Thank you.
So this doctor, author, Jay Hawker, MD, a retired pediatric consultant with ties to the Mayo Clinic, which incidentally also does not endorse water fluoridation, he recommends this statement that you might want to consult a doctor after the 6 months of non-fluoridated water. This doctor author is Jay Hawker, a retired pediatric consultant with ties to the Mayo Clinic, but not to the CDC. No such statement appears on the CDC's website. In fact, his qualifier flies in the face of CDC policy. The CDC recommends breast milk as the best feeding source for the first 6 months. Breast milk is virtually fluoride-free since nature filters that toxin out for the safety of the nursing baby. It contains at most about half of 1% of the amount of fluoride present in optimally fluoridated water. The CDC further recommends that supplements not be given between the ages of 6 months and 1 year, except in areas where the tap water is fluoride deficient. This advisory is for Austin, not the whole world. Austin's tap water is certainly not fluoride deficient, since it's what the CDC calls optimally fluoridated. So please, I ask of you, improve our messaging by removing Dr. Hawker's ill-advised plug for a commercial product, a phosphate fertilizer waste product, in fact. And speaking of fluoride supplements, it may surprise you to learn that the sodium fluoride drops or tablets routinely prescribed for children are not FDA approved. One would think a prescription drug, especially one targeting children, would have been tested by the FDA for safety and effectiveness, but such is not the case with these supplements. The explanation would take more time than I have here. And just to reiterate, the FDA has never established a daily requirement nor approved it as a nutrient or supplement in the case of fluoride.
Thank you, Ms. Greene.